The thyroid hormone has an important role in driving the body's metabolism. The thyroid hormone promotes healthy growth and development and supports muscle, skin, hair, and nails. The normal physiology of the thyroid hormone starts in the hypothalamus. A shortage of thyroid hormone causes the hypothalamus to release thyrotropin-releasing hormone, or TRH. That signal travels to the pituitary gland, and the pituitary responds by passing along the message to the thyroid gland by releasing thyroid-stimulating hormone, or TSH. The thyroid gland rests on the front of the neck, below the Adam's apple. When TSH reaches the thyroid gland, it carries the message to release more thyroid hormone. The thyroid does this by secreting T3 and T4. T3 and T4 are the two forms of the thyroid hormone. TRH and TSH work by stimulating the production and release of thyroid hormone in the body. This system works using a feedback loop. When the levels of T3 and T4 are low, more TRH and TSH is released because the thyroid is needed in the tissues of the body. When T3 and T4 levels are elevated, less TRH and TSH is released because the body does not need more thyroid hormone. Thyroid disorders involve improper amounts of circulating thyroid hormone. When there is too little thyroid hormone, the condition is called hypothyroidism. Sometimes hypothyroidism is caused by a shortage of dietary iodine, but is more commonly caused by Hashimoto's disease, an autoimmune process against the thyroid gland that reduces the production of thyroid hormone. Hypothyroidism presents as a slowing of the body's metabolism. People with hypothyroidism are often tired despite sleeping more, gain weight, feel sad or depressed, or struggle with daily motivation. We diagnose hypothyroidism through blood tests. Hypothyroidism means that there is not enough circulating thyroid hormone. The levels of T3 and T4 are low, but because thyroid-stimulating hormone, or TSH, is the call from the pituitary for the thyroid gland to make more thyroid, the level of TSH is elevated. Treatment for hypothyroidism involves the replacement of thyroid hormone with medication. Levothyroxine is the most commonly used drug, though there are other options. To correctly dose thyroid replacement, periodic lab draws of T4 and TSH are done. Hyperthyroidism is a condition of too much circulating thyroid hormone. This is usually due to an autoimmune dysfunction called Graves' disease, where the immune reaction leads to excessive thyroid secretion. A rare, though more serious condition is thyroid storm, a life-threatening excess of thyroid hormone that leads to an increase in heart rate, blood pressure, and temperature. Hyperthyroidism presents with symptoms of an accelerated metabolism. Heart palpitations, unexplained weight loss, anxiety, and tremors are some of the typical symptoms. The excess in circulating thyroid hormone means that the lab tests of free T3 and T4 will be elevated in hyperthyroidism. Because there is too much thyroid, the signal to make more thyroid in the form of TSH is low. Treatment is focused on eliminating the source of the thyroid. Surgical excision to remove all or part of the thyroid is possible, as is administration of radioactive iodine. Iodine is one of the essential components of thyroid hormone. Radioactive iodine perfectly targets the thyroid, killing the cells of the gland. Keep in mind, if hyperthyroidism is treated by removing or killing the thyroid, these individuals will then need thyroid replacement. They will have hypothyroidism secondary to treatment for hyperthyroidism. If the hyperthyroidism is mild, the medication propylthiouracil can be used.